to be talking about some of the relevant anatomy of the hip and the pelvis. So when we look at this anatomical model here, what we have is the lower spine, or the lumbar spine, which comprises of the last 5 segments in the spine, and that articulates with this very large bone down here called the sacrum, which is actually a fusion of multiple bones together, connecting to the sacrum and then making what's the end, or the very, very end of our spine, is this little guy right here, which is the coccyx. Now, on either side, we have the iliac crests here, and these, when they combine with the sacrum, comprise what's called the SI, or the sacroiliac joint. And we take a look a little bit more inferior, and we go down the iliac crest, and then we find our articulation of the proximal thigh with the hip and pelvis. So when we look at this, we're now looking at the leg, and this is the more proximal portion of the femur here. The femur articulates with the acetabulum of the pelvis. And so what we have from here is we have the acetabulum, and then we have what's called the femoral head, the neck, and then we have the greater trochanter of the femur here, and then the lesser trochanter of the femur here, and then we have what's the body of the femur.